I go to fundraisers all around the U.S., all around the world, and this is bucket list stuff for nerds like me, and it doesn't disappoint. Holy cow! I gotta say. So, as mentioned, we're the Jones Lab, and what we really are is we're the Peter and Takako Jones Lab. I'd like to mention my brilliant and beautiful wife Takako over at the table. We're a husband-wife team. Okay. And we drive in together, we work together, we have lunch together, we go home together, we talk science all the time together, so be glad you're not at our table, okay? So, and it works, at least for 18 years. So, you never know. So, yeah, I thought maybe people don't know where Nevada is. We're kind of just east of San Francisco. And we are a full-time FSHD research lab. We do diagnostics and therapeutics, and these things are related because diagnostics is going to be how you get to therapeutics, okay? Very important, and this is something that FSHD Research Global Foundation has been really big part of. So, y'all, as I understand it, a number of you maybe don't really know FSHD so well, and I got to tell you, when I started my lab, I had never heard of FSHD. The reason I'm working on FSHD is because this 18-year-old kid got diagnosed with FSHD after a long journey, and he said, hey, I got to do something about this. He sought me out. Kid shows up in my office, and he says, hey, Dr. Jones, I've been diagnosed with this disease you've probably never heard of, FSHD, facioscapulohumeral muscular dystrophy. I heard it's an epigenetic disease. I looked on the website. You work on epigenetics. Can I work on this in your lab? And, of course, I lied to him and said, of course I know what FSHD is. Come back, though, I don't have time. And I Googled FSHD to figure out what it was. And turns out it's a great idea, great disease. And because one person stood up, one person decided to make a difference, my lab is the best funded lab, one of the best funded in the world. 12 people working full-time on FSHD. We do diagnostics, therapeutic development. We're doing disease mechanisms, and we're making the models that pharma companies are using to solve the disease. One person makes a difference, like Bill Moss setting up this foundation. One person makes a difference. You don't take it all sitting down, man. So, you've never heard of it. Well, let me tell you, there's about 1 million people in the world that have this. By my math, about 3,300 in Australia are going to have FSHD. You may have it, maybe in your family, maybe you don't know about it. So what is it? I was tasked with kind of doing a little bit of you're going to be forced to learn a little bit today, okay? Sorry about that. So what is FSHD? It's a very different disease than the other muscular dystrophies. There's 9 different types of muscular dystrophies. Almost all the neuromuscular diseases are basically, you're broken. Your cells are broken. You built a house with bad bricks. FSHD is different. FSHD, your house is fine. Just every once in a while, a brick explodes. Okay, it's a dominant gain-of-function disease, and this is kind of how we think of it. Okay, you have your muscle turns to fat when one of these explosions goes off. It's a toxic gain-of-function. We don't need to fix anything. We need to break something. We got to get rid of something that your muscles don't want. Okay, but the way I really think of FSHD is this way, because we've been working on this full-time for all these years. Here's my friend Jenny. Jenny is she's 50 and she's in a wheelchair. This to me is FSHD. This is my friend Chip. Chip, though, he's 67. He's still hiking, he's still moving around, but he's fallen down and he's pretty pissed off about it. Okay? Here's my friend Michael here on the right. He's in his 40s. He's got 4 kids with FSHD. He's got FSHD himself. He's still walking. But over here, Eliza, she's also 40, and she's in a wheelchair. Okay, what's going on? There's huge variability. Right? My friend Steven here, he's in a wheelchair. They lift him in, put him into his piano bench, but he's playing Carnegie Hall because his arms are just fine. Actually, it's a blessing. The one thing that he couldn't live without is his piano playing, and that was spared for reasons we don't know. My student Ben. Ben, he looks perfectly normal, right? Grad student Ben, he's got FSHD. He couldn't take a selfie because he can't get his arms up, but he's walking okay. Right? This is a really striking example. Very famous twins. If you're Happy Days fans, these guys were the backup singers for Leather Tuscadero. But this is Jan and Jill. Jan and Jill are identical twins. They both have FSHD, but Jill had it when she was 40, and Jan wasn't affected till she was 60. 20 years apart, exactly the same. They're identical twins. They're famous for being identical, but FSHD was not identical in them. Okay? So what this means is this clinical variability really complicates diagnostics because Jenny, my friend Zeb, great Arsenal fan, and Duncan here all have FSHD. Jenny's in a wheelchair, same age as Zeb. Zeb's walking around. Duncan's 80. She's still walking around, but 2 of her kids are in wheelchairs, and 1 of them's about to get there. Okay, huge variability makes it really hard to diagnose this thing clinically. So, not going to give you too much science. I realize. All you need to know out of this is it's really complicated. The genetics are really complicated. If you've done prenatal screening or any sort of genomic screening, they're looking for a single base change in your DNA. You got 3 billion bases of DNA, 1 of them's wrong, you might be predisposed to cancer. FSHD is not like that. You have thousands and thousands and thousands of copies of the gene that makes FSHD. Only 1 of them causes FSHD. How do you find that 1 in a background of 1,000? The way you do it is actually you measure large pieces of DNA. All right, so we're looking for the difference between 100,000 bases of DNA and say 20,000 bases of DNA. It's just really hard. It's just a technicality problem that really sucks. Okay, so the way you did it, as Natalie mentioned, there was this way called the Southern blot. All you need to know, really expensive, really hard, only available in a few places in the world. They screw it up a lot, even the best people, and you get a lot of misdiagnostics, and it can take years. Okay, this really, when your kid's having problems, when you're having problems, you don't know what's wrong with you, this sucks, okay? So what do we need? We need improved diagnostics for the community. Why? For your personal well-being, personal empowerment. Okay, you got to know what's wrong with you. People know something's wrong. They want to know what's going on. Poor diagnostics, though, are a bottleneck in therapeutic development. It's not just about personal empowerment. The first question a pharma company asks me is, oh yeah, how many people have that disease? Sorry, it's just a business, man. Is it profitable to get in here, right? Well, we got to know how many people have it. Turns out, actually, most populations have never been tested for FSHD because it's just too hard, right? And this is how you're going to get to clinical trials, and this is how you're going to get to treatment. So diagnostics are tremendously important. So as Natalie mentioned, the technology is moving. This new bio-nano machine, basically all it does, it takes the old school way of doing it and just makes automated fluorescence. Now it can be done, but it's still complicated. DNA is fragile, you still need blood, this is still expensive, still not really accessible to a lot of places. You got one of these in Australia, which is fantastic. You're on the cutting edge of the gold standard, but it's really not good enough. Okay, in my opinion, it's not good enough for the world. FSHD Global, we're a global lab, FSHD is a global community. All right, so what do? Well, in 2014, when I met Nat, I also met this family, the Cheges. Okay, Chege told me that his dad used to beat him because he couldn't carry a 50-pound bag of coffee because he's just lazy bum. Now he's got muscular dystrophy. Now the town says he's got witchcraft. He's cursed. He knew that wasn't right, so he educated himself, sold part of his farm, came to Boston, said, all I want is a diagnosis. Man, how can you not help that guy? I was listening to that, I'm like, holy cow. I mean, you got to help this dude, right? And so it turns out, though, you can't. With the technology, you can't. But I was thinking about it, I'm like, you know what? I could go to the hotel lobby. I bet I could diagnose him before he leaves. I mean, it wouldn't be legal, and I would never really do that, But if I wanted to, I probably could. And why is that? Because this really complicated genetics that you see up here, all these blue triangles trying to figure out which is the right one, this is really hard. But what my lab studies and what my wife invented is how to figure this out. It's actually really easy. Now, you remember from your genetics 101, you got 1 chromosome from mom, 1 chromosome from dad. So you got 2 chromosome 4s. This is where FSHD is located. Well, if you're healthy or if you don't have FSHD, it really doesn't matter how big they are. They're off. The gene, remember, it's dominant gain of function, something expressed that you don't want. The gene is off on both of those chromosomes. If you have FSHD1, one of those chromosomes is on, the other's off. FSHD2, rare form, they're both on. So now it's easy. It's almost binary, right? Off, off, or on. And we do this in the lab all the time. Hell, I could have done it for Nat. I could have done it for Chege, and it was a research test. We do it from saliva. I was able to send 20 kits to his town in Kenya. He got in his truck during the non-rainy season, collected samples from the whole family. We figured out everybody's condition. Guess what? They don't have witchcraft. All right. So, well, that's Kenya, right? I mean, come on. It can't be that way in the U.S., right? You've never been to the U.S. if you think we got things straight, man. I have volumes of problems from testimonies from people. 25 years looking for a diagnosis. They screwed it up. And we have insurance problems. You don't want it on your insurance. You get diagnosed with a rare disease, you are legally allowed to be discriminated against in the U.S. That's actually true. People get misdiagnosed. Clinicians are throwing darts. Maybe it's this, maybe it's that. FSHD is the last one because it's expensive and hard to test. So you know what? They needed something. So it turns out we're like, hey, we can actually do this. Everyone around the U.S. needs this test, saliva testing for FSHD, for epigenetics. Well, Facebook's an interesting thing because next thing you know, I get a call from Vietnam, or a call, whatever, Facebook little thingy. And so who here has FSHD? Well, over there on the right, my friend T, right? Again, someone that looks perfectly normal, you don't even know. All she knows is the guys in Hanoi tell her, yeah, you got something. Yeah, well, she knew that. She can't lift her arms. Yeah, I got something. But it doesn't matter because they can't do nothing. Well, guess what? They end up, I send her a kid to Hanoi. We know she's got FSHD. Peru, really professional people in Peru. What do they want? They want to know what his dad got. They want to know if their kid's going to have it. Send it to Peru. You know what? What about Ukraine and Crimea? You might have heard there's some really interesting stuff going on out there. It's not a place you want to be. Really striking. You want to know how important it is to get a diagnostic? Read up here. I'm in Donetsk. The Russians are shelling my town, but I can get a package across from Ukraine so I can test my kid. Okay, that's motivated people, man. I got 3 families in Crimea. I got 16 in Ukraine. I got someone in Syria. Seriously, that's your problem? That's what you're worried about if you're living in Syria? You want to know what your muscle disease is? Yeah, they do. Everybody needs to know personal empowerment. What's wrong with me? And we can fix that. Turns out, because of Chege, one person clicked it in my head, was motivated to come from Kenya to Boston because he so badly wanted to know what disease his family had. Now, all of a sudden, we've done about 2,000 tests, 64 countries and territories. I don't know what to classify some of these things. And we've done 124 people from Australia. Okay, we're able to get diagnostics because not only are we helping people figure out what's wrong with them, but now I can tell pharma companies, hey, guess what? This is a worldwide disease. It's everywhere. So what about Australia? Well, let me tell you. People get tested, they get lost. They wait forever. I actually have about 124 testimonials on this. People just want answers, and it's been really tough. And now you guys got the BioNano through FSHD Global, and you got the initiative set up between myself, our lab, and Natalie to do our saliva testing. Why are we going to do this? Well, yeah, it's great. We're going to be able to help people figure out what's wrong with them. But the goal is, I don't want to say you got FSHD. I want to say you got FSHD, and this is what we're going to do about it. That's what we want to do, and that's what we're going to be able to do because we're going to be able to bring clinical trials to Australia, just like Bill said. You know what? If you got to be set up, pharma companies that want to come here can't if you're not set up. So we're getting the diagnostics. We're going to figure out the demographics. We're going to get all the inclusion criteria for trials because therapies are coming, and we're going to bring them to Australia. I'm in the U.S., but you know what? I don't care. FSHD is global. We're a global community. This is FSHD Global. What's good for Australia is good for the whole world. You help with this, you're helping everybody, okay? So we help Australia, we help everybody. You know what? It's going to be easier down here than the U.S. You don't believe me? Come on up and see us. So why would a pharma company want to come here? It's also cheaper here. US FDA. In the end of the day, Nat, Emma, there's my friend T. She came over here. We got 3,300 FSHDers out there in Australia. We're going to get proper genetic testing, get you all into the registry, get these people through the medical education portal. So when the pharma company says, hey, Australia is a good place to do a trial, you say, you're damn right, we got it all set up, we know where the patients are, we got the clinicians lined up, bring your therapy down here, get it tested, and then we're going to get it out to the rest of the world. Australia is going to lead. And actually, I'm looking at properties down here, I got to tell you. Australia is going to lead. This is a nice place. Australia is going to lead the world in getting things to therapy, okay? It's very personal to me. This is my group. These are my people. Patients come by my lab all the time. I get a little choked up. It's very personal to me. It's personal to Nat. It's personal to Bill. I hope it's personal to you. Thing to remember, single individuals make a difference. Bill, Chege, my student Ryan, Nat, every one of you. Individuals can really move the needle and for everybody around the world with this disease. All right, so thanks for the invitation. I love it. Come say hi to us if you want to talk science.